Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome Augusta Uwah. She's an internal medicine physician. Today's Kevin MD article is "The Dying Man Who Gave Me Flowers Changed How I See Care." Augusta, welcome to the show.
Thank you so much for having me, Kevin.
All right, let's start by briefly sharing your story, and then we'll talk about your Kevin MD article.
My name is Augusta. I am an internal medicine physician. I trained in Washington, D.C., Howard University Hospital. I've been a hospitalist for about 10 years now, mostly practicing in the Midwest. I have practiced a little bit in other states and also a little bit outside the country.
All right, so you shared this story with us in your Kevin MD article. For those who didn't get a chance to read it, tell us what it's about.
Well, the story came together. Actually, I wrote that article in about 15 minutes after a really rough month at work at the end of my 90 shift. The story is about a gentleman who had a brain tumor and was hospitalized. And there's like a lot of patients who are hospitalized, or well, not a lot of them, but some patients who are hospitalized really cannot speak for themselves. And how hard it is sometimes for us as physicians to see them and hear them and actually understand them.
Hmm.
This guy was virtually dying because at the end of the day, I really could not do anything for him. His tumor had recurred, and we were just looking at Hail Mary efforts. It was a little bit of a struggle to get all the teams on board on what to do. And like in some hospitals, the burden of the care fell to the hospitalist. And this is a patient who needed a large multidisciplinary approach. And knowing that an internal medicine physician cannot really do much for a brain tumor except
Mm-hmm.
a bit of steroids, I decided to dig a little deeper into his background and, get to know a little bit more about him, like I do for most of my patients. At baseline, this guy was thought to be altered and nonverbal, but I find that with a lot of patients, we think are nonverbal, they can communicate. And on trying to have a conversation with this guy, I found out that all I needed to do was sit with him a little longer and really give him the time to get his words out and what he needed. And I also had to think about what can I offer him as a human being. Sometimes you've reached the limits of your capacity or as a physician. He was NPU. He'd been NPU for like 14 days.
Mm-hmm.
And he had been eating prior to that, and he had some significant dysphagia, was considering a peg tube placement. But, we had the conversation about, this may not be going where we needed to go. And while you're not ready for hospice, what can I do to make your day or your
Mm-hmm.
stay a little better? And one morning, he would always light up when I walked into his room
Yeah.
because he knew that I was probably the only person that he could have a conversation with outside of one of his family members who came and spent a couple of hours a day. And he said, I would really love some coffee.
Mm.
And I said, I think there's a way we can make that happen for you. And I was like, if I was in a bed and I couldn't eat and the only thing I wanted was coffee, just a taste, how would I make that happen? And I remembered that the nurses have this little swab sticks
Mm.
that they use to swab the patient's mouths. And I kind of like, talk to the nurses like, how about instead of putting it in ice or water, we put it in coffee so that this guy can have a taste of coffee.
Yeah.
He was so happy and so excited. And we did that, for a few consecutive days. And every day I'd see him, would have a conversation. Oh, I found out he's not as altered as I thought. He was using, he was a very advanced conversationalist. He asked me, where I trained and wanted to know more about me and things like that. And towards the end of my shift, I let him know I was going to be leaving. And I was really surprised on that last day when I show up and there are flowers at his bedside. And I'm like, wow, who'd you get flowers for? Who brought you flowers, you know? And he was like, oh, they're for you. I was a little shocked by that.
Mm.
And he said he wanted to really appreciate the time I took to make him feel like a human, to talk to him, to hear him, listen to him, his needs and everything. That really touched me. I almost cried. It brought tears to my eyes.
Well, that's such a wonderful story, and it really shows how that extra effort that you took to dig a little bit deeper beneath the surface and made the connection with that patient and opened up a whole new world between the communication that you had with him. But obviously, he was just so appreciative that someone would take the time to do that.
Yeah.
Knowing how busy hospitals are, right? I'm sure that your census is very high. What are some of the obstacles that prevent doctors in general from doing that? Because sometimes I'm sure a million things, you have a big checklist, you have to get to the next patient. How difficult is it sometimes to sit down and take that extra time and make that extra connection with patients?
That's a great question. I think as hospitalists, we have a lot on our minds. There are goal-oriented tasks. You have the multidisciplinary meetings. You have the discharges before 9 a.m., 10 a.m., 11 a.m., depending on where you're working. You have the admissions. Then you actually have patient care, and you have to document and bill. So we have a lot going on. We have interactions with the specialists and so on and so forth.
Hmm.
It can be hard, but I feel that, you know, I tend to care a little more about people who really cannot speak up for themselves.
Hmm.
And I used to have fun on the job because I would have the most interesting conversations with patients. And folks would ask, you guys actually talked about all of that. And how long did you spend? I was like, maybe 15 minutes, you know? I actually had a patient that pranked me like he was aphasic. And he took the time to prank me after 3 days because his family was like, he really likes you, you know, so he pranked you. But it's not really hard if you decide that you want to take the extra effort. For instance, you see a patient wearing a t-shirt or, you know, something by their bedside and you ask them about it. And
Hmm.
they're always happy to have that slight distraction from what is hurting. You know, after you've asked them about, you know, their, or before you've asked them about, you know, what's hurting, how they're feeling today, what's going on. And sometimes it's simple thing as, what did you have for breakfast?
Hmm.
And you would notice that, I would notice that some little old ladies would have like oatmeal every day. And I'd be like, oatmeal again today, you know? So I feel like it boils down to really wanting to connect with the person as a human. That just makes all the difference.
And in this case, in the story that you told, this was a patient who literally could not speak up for himself. Do you ever find being so emotionally connected with patients, especially in cases like this, palliative care, end of life situations, does that take an emotional toll on you?
It has in recent times, you know, like I really did need to step back after, you know, this year actually. In the past, I had mostly positive interactions with that, but I was working in a neurosurgery ward basically. And a lot of these patients could not speak for themselves. And I really felt like I had to be the one to really speak up and stand in the gap for them and make sure they were being heard because they are often very overlooked. You know, not probably not intentionally, but maybe due to anchoring bias. This is how you met the patient, therefore, this is how you assume they always are.
Mm.
This was not the first patient that, you know, I had, you know, communicated with that other people had felt could not communicate. And yes, it can take an emotional toll, but this guy really, really touched me, because of his appreciation, not necessarily because of his situation. So that was really what blew me away.
Now, among your colleagues and when you talk to other physicians, how common is it that you're doing what you're doing? How common is it for physicians who do take that extra time to really sit down and especially in patients who can't express themselves, who people assume that they have nothing to say? How common is it for a physician to sit down and try to uncover that hidden connection?
I would say, generally speaking, not really.
Mhm.
Most people tend to leave it up to the nursing staff, you know, and sometimes they are just as busy if, as we are, and may not have the bandwidth, and again, for the physicians too, it may just be that they don't have the bandwidth for it. So it is not as common as I think the person on the other end would want it to be.
Now we have a lot of medical students and younger physicians and physicians in training who listen to this podcast. So tell me, what kind of tips and advice can you share with them in terms of doing what you do and trying to look for a connection beneath the surface?
That's a great question. So for medical students and physicians in training, it's important to know that everything you do matters. You know, everything matters, and you want that you want to be a positive, you want your interaction to come out positive. You
Mhm.
want what you're doing to make a positive impact on the person in front of you, because even the things we take for granted can be really life-changing to some people.
We're talking to Augusta Uwah. She is an internal medicine physician. Her article is "The Dying Man Who Gave Me Flowers Changed How I See Care." Now, this particular patient interaction, did it change you as a physician? And if so, how?
I would say I have always been this person.
Hmm.
This is not the first appreciative patient I've had. It just reinforced the importance of being connected and being sensitive, especially to patients who really cannot speak up.
And I think it's all the more important when we have so many obstacles, I'm sure, in your daily workflow that prevents doctors from making that connection, right? Everything is so metrics based, numbers based, quantity based, and that places a lot of priority away from making that connection that you told in your story.
That's correct.
All right, so let's end with some take home messages they want to leave with the Kevin MD audience.
Care about what you do.
All right, Augusta, thank you so much for sharing your story time and perspective. Thanks again for coming on the show.
Thank you very much, Kevin, for having me.